Hey guys, it's the Injury Bloke here, bringing you simple and effective advice for your aches, your pains, your niggles and your injuries. Today, I'm going to talk about upper back pain and why it doesn't need to be massaged. Guys, so I'm pretty sure that most of you watching this at some point have had upper back pain. Somewhere between the shoulder blades when you get this nasty nag somewhere around here. And a lot of the time the first port of call is to phone me up. Well, not you, but client person will phone me up and say, I need a massage because my back feels like it's got a knot in it, or it's feeling tight, or it's nagging, something like that. Now, a lot of times, it's actually not the correct measure to have a massage to this area. And this is the reason why, for a lot of us, is this part of the back, if we work in an office, if we drive a lot, if we train in an imbalanced manner, if we do things like grappling sports or boxing, anything that brings these shoulders around, what is actually happening to the mid-back muscles is that they are being stretched. So as these come forwards like so, these mid-back muscles are being pulled around and lengthened. And if you can quite see on Bob, or on Harold, so it's these muscles here between the shoulder blades are being pulled around. So I'm going to use some elastic bands. I quite like my elastic bands. You might have seen from another video. So what's happening in these mid-back muscles is that the shoulders are rounding, the shoulder blades are coming around, and those muscles in that area are actually being pulled taut, so they're actually being stretched. And so when the elastic band is quite relaxed, as those shoulder blades are coming around, the muscles get this kind of tension on them, and it makes them feel quite twangy. So when you go for a massage, you've probably experienced this, you go for a massage and the massage therapist will say, oh, that feels tight, which is not true. It might feel tight, but it's not actually tight. What's happened is those muscles are being lengthened and it makes them feel taut, like a guitar string. Imagine you're tightening up a guitar string, it becomes more and more taut, and that's what you get. So when you get a massage, when you're getting this hands-on massage, you're actually stretching those muscle fibres, but you're applying a stretch to muscles that are already being stretched. And when these muscles are being stretched, they become inhibited. They can't do their job properly. They're trying to get you back here, but because of the inhibition that's being caused by the change in posture, they can't do this as good as what they should, and that's why they become naggy. So you could get caught in this vicious circle of, let's throw a job in the air. You do a lot of driving, so your shoulders are here. That area between the shoulder blades gets naggy, so it's like, oh, naggy, I need a massage. You go and get a massage, and you might get some temporary pain relief because manipulating the fibres does that, but you're actually stretching fibres that are already stretched, and so quite soon you need it looking at again, and you just get caught in this vicious circle of them overstretched, they're not doing the job. You get a massage, it stretches them even more, temporary pain relief, it feels like it needs to be done again, and it's just round and round and round and round. Now this is where it's useful to get an assessment prior to treatment as opposed to just treatment, because a sports therapist would have assessed your posture, would have assessed your range of motion through the upper body, identified the reasons that are causing this problem, rather than just massaging the painful area or the nagging area. I hope that makes sense. So what you should actually be doing, or what the therapist should be doing and advising you on, is actually addressing the muscles that are causing the change in posture, not the muscles initially that are giving you the pain. So you'd actually be looking at working the chest, the shoulders, the biceps, deeper muscles in the chest as well, the rotator cuffs, looking at opening up the front and potentially doing work to strengthen the mid-back to help those muscles that can't do the job properly to do their job better. And that way, long term, you'll get pain relief. Okay guys, I hope you found that useful. I hope that made sense. Please do subscribe to my channel if you want to get updated with my latest videos. Drop me a comment below. I'm trying to keep as jargon free as possible, so please forgive me if I slip into that odd therapist jargony talk. I'm trying not to. Also, any requests for videos, pop them in the comments, and I'll address those at some point for you. Again, thanks for watching. I hope it's useful, guys. Take care.